A 15-month-old. First of all, should he be walking?
So 15-month-olds really should start being able to walk independently. Not all children can, and until 18 months of age, it's still within normal, and we're not going to do any major interventions other than just try and encourage and help the child, maybe some physical therapy. But at 15-month-old, they should really start being able to, especially if, holding on to someone's hand or holding on to other furniture.
If a kid doesn't walk, but it's cruising around the table, afraid to release, I'm not too worried about the kid, are we?
Sure, as long as they're doing everything else normally, everything else they're developing fine. They just have this concern, it seems, or they just don't want to. That's okay. We'll give them some more time, and we give them a couple more months, and we watch them.
If he can break Aunt Ming's vase on the table, he's okay, right?
Sure.
Okay.
Again, this is assuming that the examination is completely normal. You should still be evaluated by your doctor, but they have to make sure that as long as the muscle tone is fine and everything else is fine, it's really not too much of a concern.
Now, speech. That's a little, there's two types of speech,
Right.
Words and expressive. Should they be speaking right now, a couple of words?
Yeah, at 15-month-old, they should already have at least, one or two words, maybe more. And they're really developing their language. They're starting to use language to communicate with parents to get what they need and to get what they want.
But sometimes the language is with the hands, getting gyration. Those kids I'm okay with. But then
they'll be pointing for what they want. They can shake their head no. They might shake their head yes. They'll do all sorts, and all these count as language.
But if the kid's not trying to reach out of his little world, red flag, be evaluated by either a pediatric neurologist, developmental person, maybe send him one of those early intervention programs, because that's a very important time.
Yeah, and the first thing that any doctor should be doing in a child who's not speaking as well is doing the hearing testing. A lot of parents will say, "Oh, he definitely hears. I clap. I did."
Oh, they had a newborn test,
or they had the newborn screening. They don't realize that hearing is actually a very, very delicate balance between different frequencies, and we speak at different frequencies and languages. So a formal hearing testing where they really test the child well should be done if the child's not speaking at this age.
So in other words, he's starting to get out of his little world. He's getting into a bigger world.
Sure.
And what you wanted the kid to do, and he starts seeing what he's doing around the house, it's getting, he's a little bit independent now, isn't he?
Right. Yeah, they're definitely, especially once they start walking on their own and crawling around on their own. This is when you really need to keep your house safe. You need to block things off.
That's a very good point. They should make sure nothing within his reach or hers reach could be in the mouth. That's a poison or small object, little tiny magnets, cleaning agents. They're all potential emergency room visits. Is that true?
Sure, and I think many parents realize that. What I think they don't realize is what is within the child's reach. I think a lot of times parents think, they can't open that cabinet, or they'll never be interested, or I left them on one side of the house, they'll never get to the other side of the house. And kids move a lot faster than we realize, especially a first-time parent might not realize.
Like a pocketbook of a mother, don't put that on the floor ever.
Sure.
And if you think that safety prescription bottle is meant for you to not open, and the kid not to open too, I have news for you. The adults can't open it. The kids can figure it out.
Right. Exactly.
So anything, and includes your pocketbook, because we had some situations when the mother had medicine in the pocketbook with a safety vial, thought it was perfectly safe. And I don't know, the kid must have been an Albert Einstein of safety bottles. Right. He did it in about 2 seconds and swallowed about 20 pills. Right. So that is something people forget about.
Yeah, and this is especially of concern in when the child goes to, let's say, the grandparents' house, where a lot of times they'll give the grandparents bottles without the safety cap on it because of their arthritis, whatever other reasons. And they think that just because it's in a high cabinet or somewhere where the child can reach it, he's not going to get to it. But children climb, they get to a lot of places, and they're very curious. And these things look like candies to them. And a lot of these medications, especially medications that older people are taking, could be very dangerous for children.
And I'm going to re-emphasize, log what the kid's doing, and I want everybody to videotape at different ages what the kid's doing.
Sure.
And the reason for this, if concerns come later on of any kind of an issue, you forget what the kid did at 15 months, the kid did at 4 months. Because in case something changes or some concerns come up, it's a wise maneuver. Is that true?
Yeah, it's always great when I get a patient who comes with concerns over what their child was doing before and is doing now. And a lot of parents will come with a videotape, and I can just sit and watch the video on a DVD or on a camera itself, and that's very helpful in actually seeing, because, like we say, a picture's worth 1,000 words, and a video is really, it's very crucial in making.
And What you're
hang up.
worried about,
You see
he'll
the video,
never
you know
do it in the
exactly.
doctor's office. Is that true?
Sure.
Makes a lie of everything, but you get videotape, it proves it.
Right.